Hello and welcome to the second part of our presentation on nailing the interview. My name is Adunia Weldetensaie and I'm an HR consultant with Winnipeg Regional Health. In part 1, my colleague Janelle discussed the importance of preparation, mindfulness and relaxation techniques, the importance of role-playing and doing mock interviews with friends, and using the LEADS framework to structure your responses during an interview. Today, we will delve deeper into mastering the interview process and leaving a lasting impression on your potential employers. We will also explore techniques to showcase your skills effectively, tackle challenging questions with confidence, and build rapport with interviewers. Whether you're a seasoned professional or a fresh graduate, mastering the art of interviewing is essential for advancing your career. So let's delve in and equip ourselves with the tools and strategies needed to ace any interview and land the job of our dreams. Understanding the interview process. It is crucial to understand each stage and what is expected of you. The first stage usually involves a phone screen or initial interview where the employer assesses your qualification and interest in the role. This is followed by one or more in-person interviews where you will be evaluated on various skills such as problem solving, communication, and team collaboration. Pre-interview preparation. One important aspect of understanding the interview process is to research the organization beforehand. This includes learning about their mission, vision, values, and any recent news or developments. Additionally, it is crucial to familiarize yourself with common interview questions and practice your responses to ensure you're well prepared. And don't hesitate to ask questions during the interview to clarify scenarios or seek additional information. This demonstrates your willingness to learn and adapt in different clinical situations. Preparing for an interview as a new grad nurse involves not only showcasing your clinical knowledge, but also demonstrating your ability to prioritize and handle challenging situations effectively. Here are some tips to help you prepare. Understand the situation. Practice scenarios where you're required to prioritize tasks and make quick decisions, such as responding to emergencies or managing multiple patient needs. Review clinical guidelines. Familiarize yourself with clinical protocols and guidelines relevant to common scenarios in nursing practice, including emergency responses like chest pain or respiratory distress. Develop critical thinking skills. Practice critical thinking exercises that require you to analyze information, prioritize action, and anticipate potential outcomes in various scenarios. Communication skills is also important. Practice clear and concise communication, both verbal and nonverbal, to help effectively convey information to colleagues, patients, and their families during stressful situations. Dressing for success. Dress professionally and conservatively, reflecting the culture of the healthcare setting. Ensure your attire is clean, neat, and appropriate for the interview environment. Keep it simple. Pay attention to grooming, including hair, trim nails, and clean attire. During the interview, in order to help with the nerves, arrive early so you have time to familiarize yourself with the environment. Greet everyone warmly and maintain positive body language. You never know who's watching. Listen attentively to the questions and respond thoughtfully, drawing on your clinical experience and coursework. Let's go over some common interview questions you might encounter and how to approach them. The classic tell me about yourself question. It's like the opening act of your interview, so set the stage. The purpose of this question is to understand your motivation and passion for nursing, so resist the urge to discuss your personal interests or your favorite foods.
A sample answer would be, I choose nursing because of a strong desire to help others and make a positive impact on their lives. My interest in healthcare started when I volunteered at a local hospital during high school and saw the profound difference nurses made in patient care. I believe that nursing combines with my compassion for people with my interest in science, and I'm eager to contribute patient well-being through my work.
Another common question, how do you handle stressful situations? And the purpose of this question is to assess your ability to remain calm and effective under pressure.
The sample answers would be, In stressful situations, I prioritize tasks and focus on one thing at a time to stay organized. During my clinical rotations, I learn to take deep breaths and keep a positive attitude, which helps me maintain composure. I also communicate effectively with my team to ensure that we're all on the same page, which helps manage stress collectively. This approach allows me to provide the best possible care even in high pressure situations.
Next question. Can you describe a time when you demonstrated excellent teamwork skills? And the purpose of this question is to evaluate your teamwork and collaboration skills.
A sample answer would be during my clinical rotations, I frequently worked as part of a healthcare team, collaborating with doctors, nurses, and other healthcare professionals. For example, I was part of a team responsible for a patient with complex needs, where communication and coordination were vital. I actively listened, contributed my observation, and supported my colleagues to provide comprehensive care. This experience taught me the importance of teamwork in delivering effective patient care.
Next question. How do you ensure accuracy and attention to detail in your work? And the purpose of this question is to gauge your commitment to accuracy and preventing error in the field.
A sample answer would be ensuring accuracy and attention to detail is crucial in nursing. So I double check all my work from medication administration to patient documentation. During my clinical training, I develop a habit of cross-referencing patient information and using checklists to avoid mistakes. I also ask for help or clarification when needed to ensure I am following the correct procedures. This meticulous approach helps me ensure patient safety and high quality care.
And lastly, how do you plan to stay current with advancement in nursing and healthcare? And the purpose of this question is to understand your commitment to continuous learning and professional development.
A sample answer would be staying current with advancements in nursing is important to me. So I plan to attend workshops, conferences, and continuing education courses regularly. I also subscribe to several nursing journals and participate in online forums and professional networks. Additionally, I am interested in obtaining certification in specialized areas to enhance my skills. This commitment to lifelong learning ensures that I can provide the best care possible and adapt to new practices and technologies in healthcare.
Acing the post-interview follow-up. After a successful interview, it's very important to follow up promptly by sending a thank you email to each interviewer. Highlight 1 to 2 key points demonstrating your qualification and fit. This follow-up email is also a good chance to address any lingering questions or concerns you might have. Maintain regular communication with the hiring manager. Provide any additional material they request to showcase your commitment and professionalism. The follow-up can help keep you top of mind and increase your chances of a job offer. This brings us to the end. With a little bit of prep, a dash of humor, and a whole lot of passion, you'll be acing your nurse interview like a pro in no time. Thank you for your participation and attention today, and best of luck with your upcoming nurse interviews.